Hello students, and welcome to part 2 of our discussion on bones. We're going to discuss parts of the human skeleton, and as we mentioned at the beginning of the course, there are two main parts, well actually three main parts to the human skeleton. If you look at the skull, the spinal cord, the ribs, and the sacrum, that is considered to be the axial skeleton, because if you imagine, you know what an axis is. An axis is like a rod or a stick, an axis around which other things rotate. And so the axial skeleton is kind of like a rod or a stick around which the appendages rotate. So the central part of the skeleton is referred to the axial skeleton. We'll learn the names of a lot of the bones in that skeleton, in the axial skeleton. And then appended to the skeleton, appendices. The appended to the skeleton, we have the pelvic girdle, which is the legs basically, which the legs and the pelvis, which are attached to basically to the sacrum at the bottom end of the axial skeleton, and the pectoral girdle, which is the arms attached at the shoulders. Right, so we have the axial skeleton and the appendicular skeleton, which includes the arms and the legs that are attached to it. Okay, so the main things we're going to talk about are the skull, the cranial vault. The cranial vault is a term that is used to refer to the bones that encase the skull, the cranial vault, as if it was a bank vault holding money inside it. And then the maxilla is the upper part of the jaw, right below your nose. And then the mandible is the jaw itself, right? So when you talk about the jawbone, where the jawbone is the common term, the technical term is the mandible. And then sometimes we have things that are just underneath the mandible, and we call them submandibular this or that, for instance. And then we'll talk about some of the major holes in the skull. There's an ear hole. There are two holes that let blood vessels into the skull, and there's a large hole at the back of the skull called the foramen magnum that allows the spinal cord to go in and out of the skull to the brain. Right. Then we'll talk about the vertebral column. The vertebral column is the backbone, as it's commonly called. And by the time we're finished that section, you should know how to recognize every single bone in the human backbone. And it is divided into 4 different sections, and the vertebral backbones from each of those sections can easily be distinguished by their physical features. And then we'll talk about a few spinal pathologies. This is where you have a crooked spine or a bent spine. We'll discuss a few of those. You should be paying attention to the pathologies because they will be on the midterm exam and the final exam. They won't be on any of the lab coloring book tests, but they will be on the midterm and the final exam. All right, so the midterm exam focuses mainly on the lecture materials, and the other little quizzes that we're taking every week focus on information from the coloring book. And then at the end of the year, everything will be covered on the final exam, including the coloring book material and the lecture material. Okay, so below the vertebral column, we have or attached to the vertebral column, we have what's known as the thoracic cage. So at this point, you're very familiar with what the thorax is, and then cage means exactly what it sounds like. It's the ribs that encage the lungs and the heart. And the dividing line, of course, between the thorax and the abdomen is the diaphragm, right? So the diaphragm is needed for breathing, but it is also used as an anatomical landmark to distinguish between the thorax and the abdomen. It's kind of like the border between the thorax and the abdomen. Okay, so here you have a good illustration of the axial skeleton. Right, so the axial skeleton includes the skull, the vertebral column, and the thoracic cage. The thoracic cage is the ribs. The vertebral column, you know what that is, and you know what the skull is. Right, now, sometimes I should warn you that sometimes on tests I ask, name which bone is this or that, and sometimes people, I'm referring to or I'm asking a question about a particular bone in the skull, but sometimes I get the incorrect answer where students answer the skull. Well, the skull is not a bone. The skull is several bones, right? So you can never, just for your own information, you can never answer a question when I ask you for the name of a specific bone. You can never answer that question by saying the skull, because the skull is not a bone. It is a collection of several bones. Okay, now in brackets here we have the hyoid bone. The hyoid bone is located just under the mandible, and it is located just above the larynx, and it is a little tiny bone that is in the throat. One of the things that makes the hyoid bone unique is that two things really. One is that it is easily broken because it's kind of small and fragile, but also it is the only skeletal bone. It is the only bone in the human skeleton that is not attached to any other bones, right? If you are interested in, this is kind of a grim subject, but if you're interested in forensics, police investigations where police are investigating murders and things of that nature, one of the main ways that a forensic pathologist who investigates criminal murders, one of the ways that they determine whether somebody was strangled is they look for fractures or cracks or breaks in the hyoid bone, because that means that somebody tied something around your neck or somebody throttled you by the neck and it with such force that the hyoid bone fractured, cracked, or broke. So the hyoid bone is kind of important for that reason. It's also useful in swallowing, so we couldn't swallow without a hyoid bone. All right, so we'll see the hyoid bone later, but as I said, one of the things that makes the hyoid bone unique is that it's not attached to any other bone. And remember, when two bones come together into a joint, that is where two bones come together, where they join together, that is referred to as an articulation. Articulation. So the correct way of saying what I just said is to say that the hyoid bone is unique because it doesn't articulate with any other bone. So if you look at the arm, for instance, we have the humerus and then the ulna and the radius. You would say that the humerus articulates with the ulna. You would say that the humerus articulates with the radius. You would say that the femur articulates with the tibia. You would say that you would say that the clavicle articulates with the scapula, right? But you cannot say that the hyoid bone articulates with anything, because it doesn't. It doesn't actually join with any other bones. All right, so this in blue is the axial skeleton. Let's begin discussing the skull. All right, this is an outer view of the skull. Right, this large area where the brain is contained is referred to as the cranium, but the cranium is not actually the skull. So the cranium is a part of the skull. The cranium refers to, and also the cranium is not a single bone. The cranium refers to all of the bones that encase the brain. And the cranium, also known as the cranial vault, also is not a single bone, right? But it is a part of the skull. It is not the skull, for instance. All right, now you notice that up here in the front we have the frontal bone, as you would expect. You do need to know what that is. Right? Then behind the frontal bone, just posterior to the frontal bone, we have two occipital bones. There is a left and a right occipital bone. You can't see the other one because it's on the other side. But the frontal bone is in the front, and there's only one of them. Right? So remember that there are two occipital bones, a left and a right occipital bone. Then at the very back of the skull, we have, I'm sorry, I got that completely wrong. The occipital bone, there is only one. Right? There is only one occipital bone. There are two parietal bones. Right? There is a left and a right parietal bone. I apologize for that. All right, so there is a left and a right parietal bone, and there is also a left and a right temporal bone. Right? So there are two parietal bones, two temporal bones, but there is only one occipital bone, and there is only one frontal bone. Right? So you do need to know that definitely. Now these bones that are the frontal bone, the occipital bone, and the two temporal bones and the two parietal bones all together comprise the cranial vault. They comprise the cranial vault because they contain and protect the brain, which is probably the most sensitive organ in the whole body. The brain cannot tolerate any kind of pressure or injury at all. It's very delicate, and so it must be protected. Within the cranium, we have a layer of fluid that cushions the brain on the inside of the skull as well, on the inside of the cranium as well, just as kind of a buffer, so that the brain, if the head is hit by an impact, the brain will kind of slosh back and forth in this liquid without hitting the inner surface of the cranium. Okay, now notice that these bones are joined together, but they are still separate. So if you've ever seen an old dried out old human skull, you'll notice that it can easily be broken into these the frontal bone, the occipital bone, the temporal bones, and the parietal bones can easily fall apart because they are joined together by joints. They're not a single solid bone. However, these articulations, these joints between the plates of the skull, the plates of the cranium, they are called sutures. And one of the characteristics of sutures is that they are joints between bones that are not flexible, right? So a suture is a joint that occurs between bones which is not flexible. It does not move at all, right? So they are called sutures. Right? Okay, now notice here that we have the zygomatic bone, right there, right? That's the zygomatic bone. So there are two of those. There's a left and a right zygotic bone, and then they join with an appendage, like a part of the temporal bone that sticks out. And the two of them together, the zygomatic bone and the zygomatic process of the temporal bone, form what is called the zygomatic arch. The zygomatic arch is commonly known as the cheekbone. Right? So your cheekbones, which you can easily push on the front of your face and you can feel the cheekbones, those are made up of two bones. They're made up of the zygomatic process of the temporal bone as well as the zygomatic bone. They meet together. Collectively, they are referred to as the zygomatic arch. All right, now here, right below your nose and above your mouth, we have the maxilla. This is the top part of the jaw. The maxilla contains the top teeth. Right, so there's the maxilla. And then below the maxilla, we have the mandible, which is the actual jawbone. Right? And then the jawbone is attached by two little joints to the rest of the skull. Right? And one of them is called the mandibular condyle. Right, and that is back here. Notice that there's a hole back here. I've drawn over it with the highlighter quite badly, but there's a hole there, which is called the external auditory meatus or the external acoustic meatus. It goes by both names, and that is the ear hole. Right, and then notice here there's an eye socket, common name eye socket. We call the whole bone structure around the eye socket an orbit. Right, and let's take a look at some other views of the skull. So here we have the cranial vault showing inside. Now remember that we discussed the fact that a dent in a bone, kind of an internal bowl-shaped dent, is called a fossa, right? So there is a posterior cranial fossa, there's a middle cranial fossa, and there's an anterior cranial fossa, which contain the kind of bulgy parts located at the bottom of the brain, and we'll discuss those in detail quite a bit later. Okay, so now remember that when we were on the previous slide, we said that the brain has one frontal bone and at the front of the skull, and then it has an occipital bone at the back of the skull, and then it has a left and right parietal bone and a left and right temporal bone. And I've highlighted these over here in red. And when we get to the nervous system, when we start talking about the nervous system, remember that the parts of the brain and the parts of the skull that protect those parts of the brain have the same names, right? So the frontal bone protects the frontal lobe of the brain. The occipital plate, the occipital bone, protects the occipital lobe of the brain. The parietal bones, we have a left and a right parietal bone that protect the left and right parietal lobes of the brain. And then we have a left and a right temporal bone that protect the left and right temporal lobes of the brain. Right, so then here again we have the zygomatic bone together with the temporal bone. It forms the zygomatic arch, and then we have the maxilla, and then we have the mandible. Okay, so this is looking at the skull from the inside. Right, now notice one other thing here. So um, we have the hyoid bone visible suddenly, right? So there it is, right? There's the hyoid bone. Okay, now notice that there's a bone in the middle of your nose. We're looking at this from the side. This is a lateral view, right? But that bone is called the vomer, right? And then there are two bones around here that are called the palatine bone and the sphenoid bone, and we'll talk about those later. And then here we have the external auditory meatus. This is looking at it from the inside, so that's the ear hole, so the ears go in through the skull. That's on the outside, so this is looking at it from the inside, and so that's the inside view of the. On the inside, it's referred to as the internal auditory meatus. The word meatus means kind of a entrance to a canal, entrance to a small narrow tunnel, meatus. Okay, so as we said, the hyoid bone is critical. It's critical for swallowing and speaking. We couldn't do either of those things without it. All right, so here we have the attachments of the mandible to the skull. The attachments of the mandible to the cranial vault. So here at the back, we have a little hinge called the mandibular condyle. Right, so remember that condyle is a kind of a small rounded knob. Right, and then over here we have the coronoid process. Remember, a process is a pointy bit that sticks out. Right? And so the jaw is fixed to the cranial vault using the left and right mandibular condyles and the left and right coronoid processes. And notice that we have the mandibular, the mandibular ramus. Right, and we're going to talk later on when we get to the muscle section about how the mandibular ramus is an attachment point for a very important muscle called the masseter muscle, which is used for chewing. Okay, all right. Okay, so the mandibular ramus. Okay, now we're looking inside the skull. This is a superior view, so we're looking. This is a superior view of a transverse section through the skull. Through the cranial vault, in fact. And you see here we were talking about these anterior cranial fossas. So these two dents on the inside of the frontal bone are for the frontal lobes of the brain. These two dents in here are for the left and right bottom bulgy parts of the temporal lobe and so on. And then here we have the left and right posterior cranial fossa that hold the left and right lobes of the occipital cortex, or the occipital lobes, which we'll talk about when we get to the nervous system. All right, so remember that the skull is held together by sutures. You can sort of see some of those sutures on the inside. Okay, and then here we have this marvelous big hole, which is actually called the foramen magnum. Foramen magnum, the word foramen is Latin for hole, and the word magnum is Latin for big. So it literally translates as a big hole. And it allows the nerves to travel from the brain down the spinal column and back up from the spinal column into the brain. That's the main purpose of the foramen magnum. But it also allows some blood vessels to enter the cranial vault as well and bring blood to and take blood away from the brain. Now here's a little bone called the sphenoid bone, which is butterfly shaped and quite pretty. It's an important bone, so you would find the sphenoid bone inside the skull. So we were just looking at a superior view of the sphenoid bone where it looks like a butterfly, but these are frontal views of the same bone. Right, so you see it's quite large and intricate. Right, and so it sort of holds the sinuses of your head together. So it's located behind the nose, and it kind of behind the nose and behind the eyes, and it kind of holds the whole front collection of bones in your skull together is held together by the sphenoid bone. Okay, now I mentioned the fact that blood vessels get in and out of the brain through the foramen magnum, and that's true. But these are just some little tiny blood vessels that get in and out of the foramen magnum, which which are part of. We'll talk about those later, but they're part of the vertebra. Some blood vessels that travel through the cervical vertebra enter the skull through the foramen magnum, but the main purpose of the foramen magnum is to allow the nerves from the brain to go up and down the spinal cord and enter the skull or exit through the skull. All right, now these other little holes that I'm pointing to with the red and the blue arrow are the main blood supply holes for the skull, for the cranial vault rather. So the main blood supply to the brain either enters the cranial vault or exits from the cranial vault through these two holes that are pointed to by the arrows, that are indicated by the arrows. The blue ones, the two blue ones, are referred to as the jugular foramen, and the two red ones are referred to as the carotid canals. And you might have heard of the carotid artery. The carotid artery is there are two of them. There's a left and a right carotid artery, and those are the two main ways that blood gets into the brain. And then after the blood has delivered oxygen and nutrients to the brain, then the oxygen depleted blood supply has to get out of the cranial vault. And so we have the oxygen depleted blood is traveling back to the heart, generally through veins. And the two veins that carry the blood away from the brain are called the left and the right jugular veins. Right? So you might have heard in literature and things like that, there's a metaphor that English speakers use when they talk about, if you're arguing with somebody or if you insult somebody very strongly and painfully, you say that you went for the jugular. Or if you do something drastic or something, you say you go for the jugular. Or if so that is a slightly incorrect metaphor, which means that you've attacked or cut or broken somebody's jugular vein, which is a quick way to kill them. But in fact, if you did cut somebody's jugular vein, they would die much more slowly than if you cut the carotid artery, because what happens is that if you cut the jugular vein, the blood coming out of the brain is affected, but you still get a supply of blood coming into the brain, right? So the blood coming into the brain goes in through the carotid canal. Right now, if you cut off the blood supply to the brain for more than a couple of seconds, you faint. And then if you continue to cut it off, it's not long before you die. But if the brain cannot function without blood, without oxygenated blood for any length of time at all. So if you cut the carotid artery, that kills somebody much faster. So that metaphor about going for the jugular vein is kind of an incorrect metaphor. But now you're learning anatomy, so you know the correct metaphor. You should say you go for the carotid in your argument or something like that. Okay, so here are the eye sockets, which are commonly called the orbits, right? And so notice that we have a little hole a little hole above the eye sockets and a little hole below the eye sockets. And so again, those are called foramen, right? So the supraorbital foramina, right? So they are holes just above the orbits, right? And you can also see the vomer inside the skull here. I mean, inside the hole where the nose is. And of course, the reason why you don't see any ears here and you don't see a nose here is because the ears and the nose are they're made out of cartilage, and cartilage decomposes quite fast. So you would never, it's very rare that you would find an old skeleton or skeletal remains that still have a nose or ears attached, because that connective tissue that makes the cartilage that's in the nose and the ears decomposes quite quickly. Okay, now this area, this hole where the nose is referred to as the nasal concha. The word concha is Latin for seashell, right? So if it's the shape of a seashell, then it's called a concha or a conch, right? So you hear those kind of words in Latin, right? And then the central part, the vomer and so on, the central part is called the nasal septum, which includes the vomer. And then again, you can see the maxilla, and then you can see the infraorbital foramen. Right? So these are names for little holes that you find in the skull. Right? So there is the nasal concha, and you can see the vomer bone inside it. All right, here's another bone that you find sort of behind the nose and behind the eyes, which is called the ethmoid bone. right? This is another kind of butterfly-shaped bone, which is along another critical bone in the skull, which kind of holds a lot of the pieces together on the front side, on the anterior side of the skull. Right? And it also contains the sinuses, right? So we have a bunch of sphenoid sinuses. These are basically just air pockets that are formed by the folds of the sphenoid bone, and then we have ethmoid air cells, which are also sinuses that are formed by kind of pockets that are found in the ethmoid bone. All right, so here you can see the vomer bone again, right? And then there's a little bit of cartilage here, which may still be there depending on the condition of the skull, right? And then here, this hard part of which is sometimes called the hard palate or the roof of your mouth, right, is called the palatine process of the maxilla, right? So the roof of your mouth technically is called the palatine process of the maxilla. Okay, here's a good look at the sutures that hold the brain plates together, and each of the sutures is given a name, and you have to remember the names of the sutures, the cranial sutures as well. Right, so notice the coronal suture, because it's making a coronal section through the skull. The lambdoid suture, and the sagittal suture, because it's drawing a sagittal plane through the skull. Now here's an interesting fact. When a newborn baby is born, the sutures, the cranial sutures, have not yet fully closed. So you have to be very careful because a baby has soft spots on its head where the sutures have not closed yet, and those soft spots are collectively called fontanelles. Fontanelles, right? So these are the little soft spots on a baby's head are referred to as fontanelles. Okay, so here's a skull from a baby, and each one of those places where the cranial sutures have not yet closed, each one of them has a different name for the different fontanelles, right? So there's an anterior fontanelle, there's a posterior fontanelle, right? Then there's an occipital, a mastoid fontanelle, right? And you don't have to memorize those. You do not have to memorize those. Just remember that they are called fontanelles, the soft spots on a baby's head. All right, let's have a look at the vertebral column now. Okay, so vertebrae are the collective term for vertebra. So notice that we have up here, we have several curves. The backbone, the spinal column curves in several different ways. Concave, convex. This is the one here is concave, convex, concave, convex. Right. Now, we've arbitrarily divided up the spinal vertebra because according to different categories, because they have certain characteristics in common that make them different from other vertebra. So you have to learn the names of all the sections of the spinal column as well as the vertebra within them. Right. So first of all is the cervical vertebrae. Cervical vertebrae go basically, it's referring basically to the vertebra in your neck. Right? And there are 7 of them, right? So there are 7 cervical vertebrae, and they are given numbers C1 through C7, C1 through C7, except that the first 2, cervical vertebra C1 and cervical vertebra C2, have special names that we give to them in addition to their numbers, right? And the top one is referred to as the axis. The atlas. So C1, the very top cervical vertebra, is called the atlas because I don't know if any of you have studied or just for amusement read or heard of Greek mythology. The ancient Greeks believed that there was a giant god named Atlas who was holding the world on his back, right? So he was the one that was holding the world up. And so here we have a skull that looks kind of like a globe, kind of like the world. So they call the bone that's holding the world up, they call it the atlas. Right. Next, C2, cervical vertebra 2, is what allows the head to rotate from left and right when you look left versus right. And anything that rotates is called an axis. Right, so the second cervical vertebra is referred to as the axis. So we have the atlas and the axis. Those are C1 and C2. There are 7 cervical vertebrae in total. Right. By the way, the cervical vertebrae are easily damaged or broken, causing spinal cord injuries from traffic accidents and things like that. And we will talk about those later in detail. Okay, now as soon as we get to the collarbone or the clavicle, then we start giving between the clavicle and the abdomen, basically we give the vertebra different names. We call them the thoracic vertebra, and there are 12 of them, and they are given the numbers T1 through T2, right? T12 rather, right? Okay, now what did we call the small part of the back again? The lower part of the lower back again? You remember it's called the lumbus, right? So there are 5 lumbar vertebrae, which are given numbers L1 through L5. And then down here, what did we call this area right here? The sacrum, the sacral area, right? So the sacrum is actually made, the sacrum is actually made of 5 vertebrae that are fused together, right? So they are not actually separate. So you have this triangular bone at the base of the spine that looks kind of like a shovel or something like that, like a spade shovel, like a gardening spade. And it is called the sacrum, and it's made of 5 fused vertebrae that are not flexible because they're fused together. Right? And at the very bottom, the very end of the spinal column is a little tiny thing about the size of your small finger, which is called the coccyx. Right, so the coccyx, in humans, that's where the spinal cord ends, but in other animals that have a tail, the coccyx and the sacral bones continue. So you have more, actually have spinal vertebrae going down the tail of animals that have tails. Right. Okay, so this area here where the 7 cervical vertebrae curve inwards concavely is referred to as the cervical curvature. Then we have the thoracic curvature, which is a convex curvature. Then we have the lumbar curvature, which is a concave meaning bending inwards instead of outwards. And then the sacral curvature, which is again a convex curvature. All right, looking a frontal or a frontal view of the spinal column, right? So you can see the sacrum down here made of 5 fused vertebrae. There are 5 lumbar vertebrae here. There are 12 thoracic vertebrae here. And then there are 7 cervical vertebrae here. All right, let's briefly talk about some of the pathologies of the spinal column. So when you're growing or developing, or if you have osteoporosis, the bones in the spinal vertebra are not strong enough, and sometimes they kind of crunch together like an old, like an like an old piece of chalk or something, and so you end up having a curved spine. So there are 3 different curvatures of the spine, abnormal curvatures of the spine, depending on which direction it curves in. One of them is called scoliosis, right, where you have the spine looks kind of S-shaped when you view it from the front or the back. It looks normal if you view it from the side, but it looks kind of S-shaped if you view it from the side. And the fact that it looks S-shaped helps you to memorize that word because it begins with the letter S. So scoliosis, the spine is S-shaped, begins with the letter S. All right. Kyphosis is an exaggerated bend of the thoracic version, an exaggerated, which is a a convex bend to begin with. So it's basically a hunchback. The hunchback of Notre Dame had kyphosis. And then lordosis is where the lumbar the lumbar curvature is exaggerated, right? So in kyphosis, we have an exaggerated curve of the thoracic curvature, which is bending outwards, which gives you a hump. And then lordosis is an exaggerated curve of the lumbar vertebra, which gives you kind of a pot belly shape, where the abdomen is kind of pushed forward. That's called lordosis. And the reasons for these things could be several-fold. What is the etiology? Remember that etiology is the mechanism for the disease. One possible reason for causing all of these things is osteoporosis. So the bones are not as strong as they used to be, so they kind of crunch down on each other like a piece of brittle chalk, and then they have, they're not the way they're supposed to be. Alternatively, there are lots and lots of muscles that are attached to the spinal vertebra, which we'll discuss later. And if those muscles are weakened or deteriorated somehow, which is the case in some diseases, right? So cystic fibrosis, or sorry, not cystic fibrosis. I've forgotten the name right now. It'll come to me later. But anyway, so if you have these muscular dystrophy, muscular dystrophy. So muscular dystrophy is a common symptom of muscular dystrophy, for instance, is lordosis, where the person appears to walk with kind of a protruding abdomen, a protruding belly, and that's because the back muscles are deteriorating. So the back muscles are not holding the spinal vertebra upright anymore. All right, so here we have scoliosis. When viewed from the back or the front, the spine forms an S shape. The fact that it forms an S shape makes it easy to memorize the name of the word. Kyphosis, commonly known as a hunchback, is an exaggerated curve of the thoracic vertebra, right? And it is caused often by deterioration of the thoracic vertebra on the anterior side. Okay, and then lordosis is an exaggerated bend forward. This woman looks like she's kind of pregnant, like the silhouette of a pregnant woman. But a better example would be muscular dystrophy. So one of the most common symptoms of muscular dystrophy, which is a genetic disease, is that the person walks with with their stomach out in the front because the muscles in their back are not strong enough to keep them upright anymore. All right, now we need to learn some of the general features of the vertebra themselves, right? So in the middle, well, first of all, at the back, see here we have the posterior side of the vertebra versus the anterior side. So sticking out of the back, we have the spinous process. Remember, a process is a pointy bit of a bone that sticks out. And then we also have on the left and right, we have two transverse processes. So the word transverse means from side to side. Right? So every vertebra, or almost every vertebra, has a spinous process and then which sticks directly out the back, out of the posterior side, and two transverse processes which stick sort of out of the sides at a 45-degree angle. Right? And then the central part, the body, this is called the body, is called the centrum or the body. Centrum is better. It's the more technical word. So usually if I ask you on an exam, give me the name of the central part, or give me the name of the body of a spinal vertebra, you would say the centrum. That's what that is, a centrum. Right? And then there's a hole in the middle of the spinal vertebra called the vertebral foramen, and that of course is where the spinal cord runs, right? So the spinal cord doesn't actually the nerves in the spinal column, the nerves in the spinal cord do not actually run through the vertebra, they run through a hole in the vertebra, right? So they're kind of encased by the spinal cord is running, the nerves of the spinal cord is running up and down through the vertebral foramina of all of these vertebrae. All right, now there's kind of a cushion that acts as a shock absorber that's located in between each one of these vertebrae, which is of course called a disc, a vertebral disc. And the vertebral disc is not made of bone; it's made of fibrous connective tissue. Right? And then we'll talk about this, but the disc, the vertebral discs, are made of fibrous connective tissue, which is kind of soft in the center, and the central part of the disc is called the nucleus pulposus, and it's kind of tough on the outsides, on the periphery of the disc, and that's called the annulus fibrosus. Right? So vertebral discs are made of fibrous connective tissue. You find vertebral discs in between each of the vertebrae, basically to act as shock absorbers, like a pillow to absorb shock. And then the very center of the disc is called the nucleus pulposus, and the outer part of the disc is called the annulus fibrosus. Okay, so here you can see the spinal column running through the vertebral foramina of several different vertebrae. Here you can see the centrum. By looking at these, the centrum is very thick, and so you can tell that these are lumbar vertebrae, and you'll learn how to tell the difference in a minute. But basically, the lumbar vertebrae have the thickest centra. Right, so the vertebra with a very thick centrum like that is probably a lumbar vertebra, and that is something that you'll have to recognize. You do have to memorize the difference in appearance between a thoracic vertebra, a cervical vertebra, and a lumbar vertebra. Okay, so here we have the disc. There's a disc acting as a cushion in between each of the spinal vertebrae, and then the outer part is called the annulus fibrosus, and the interior central part is called the nucleus pulposus, and then here's the vertebral foramina. So the spinal column, the nerves of the spinal column don't actually come anywhere near the disc, but occasionally you get something called a slipped disc. And if this disc slips out from slightly, it doesn't come out completely, but if it slips out slightly, it could put pressure on the nerves that are running through the vertebral foramen, and that causes a terrible backache. That causes terrible pains, because generally, if you pinch nerves, if you squeeze or apply pressure to nerves, it has the result of causing severe pain, right? So that's the case in when you have a slipped disc, you have terrible pain in your back. That's the case when you have some of the muscles and tendons squeezing on the large nerve in your leg called the sciatic nerve, and then you get something called sciatica. So nerves don't like to be pinched. They don't like to have pressure put on them. They do not tolerate that very well at all. Okay, let's take a look at the classic characteristics of cervical vertebrae. So in a week or so, if I ask you to tell me whether this is a cervical vertebra, a lumbar vertebra, or a thoracic vertebra, you will easily be able to tell me that this is a cervical vertebra, because two reasons, right? Now, one is, notice that the transverse processes, the pointy bits that stick out, they each have a hole, right? They each have a hole in them, right? And those are referred to, those little holes are referred to as the left and right transverse foramina. The transverse foramina are where blood vessels run through that are headed to the skull, headed to the cranial vault. So the transverse foramina, the left and right transverse foramina, carry the jugular vein. I'm sorry, no, not the jugular vein. The cervical arteries and the cervical veins, which carry blood to the brain and enter through the foramen magnum. Right, so we'll talk about that later when we talk about the blood supply, but for now just memorize the fact that in a cervical vertebra, in all 7 of the cervical vertebra, that they all have transverse foramina, like they all have transverse processes like every other vertebra, but only the cervical vertebra have holes in the transverse processes, and those are to carry blood vessels to the brain and back. Right, and notice that this one. This one has the cervical vertebra have a bifid spinous process. So instead of coming out as a single point, it's kind of a V shape like that. That's a characteristic that is a characteristic that only the spinal vertebra have. Right. So there's the spinous foramina. All right, now the C1 and C2 I told you have special names. C1 is called the Atlas because it's holding up the skull, just like Atlas, the ancient Greek god holding up the world. And then the axis, which is C2, is given its name because it allows the skull to rotate on the end of the spine. Right, so here we have the Atlas on the left. Right, the Atlas, you need to know, the Atlas is the only vertebra in the body that does not have a spinous process. It doesn't have a spinous process. Right, here we have C2, the axis, and you notice it does have a spinous process, but it's given a special name. It's called the dens. Right? And then notice again that we have the transverse foramina, little holes in the left and right transverse process. Right. So then there's a thing here. This little bump here in the Atlas is called the dens, which is a facet that the skull sits on top of. And notice that the foramen is the spinal foramen is quite large compared to and there is no body really. So the C1 and C2 have no body, and they have a biffed. Starting from C2 to C7, there's a biffed spinal process. That's bifid means splits in two, right? So it has 2 points instead of 1. Right. Now, interestingly, the transverse processes and the spinal processes and the transverse processes are attachment sites for muscles. They're not just there for appearance. They're actually the attachment sites for many muscles, which we'll talk about later. Okay, so here we have the Atlas at the very top, right? So it doesn't have, the Atlas is the only vertebra that doesn't have a spinous process sticking out of the back. And then we have the axis next, and all the other ones have a bifid spinous process, except for the last one, which is C7. So it has a very large process sticking out, vertebra prominens. Okay, now the thoracic vertebrae have interesting characteristics because the thoracic vertebrae are the only vertebrae that articulate with the ribs. Remember, the word articulate means to join, two bones joined together. Right, so the thoracic vertebra are the, if I ask you on a test which vertebra do the ribs attach to, they attach only to the thoracic vertebra. That's one of the ways we define them as being thoracic. Right, so thoracic vertebra, they have a relatively large centrum, but not as large as the lumbar vertebra. They have a relatively long spinous process. They do not have any transverse processes. Well, they sort of do, but they have a transverse processes, but it's a facet, and we'll talk about that in a minute. Okay, so now the articular facet, there's a superior and an inferior articular facet, which superior and interior costal facets. The word costal, whenever you hear the word costal, it refers to the ribs, right? So don't forget the word costal refers to the ribs, right? And so these are little facets. The superior and inferior costal facets are where the ribs are attached to these these thoracic vertebrae. Right? And then we do have transverse processes, but they're quite small compared to they're a little bit small compared to the cervical processes, the transverse processes. Okay, so once again, the superior and inferior costal facets are attachment points for the ribs. So the cervical vertebrae are the only vertebrae that have these, because the cervical vertebrae are the only vertebrae that articulate with the ribs. Right, and notice that the spinal process is quite long and pointy. Okay, so here we have the costal facets are for the attachment of the ribs. While we're here, I may as well explain some of these parts. Right, so notice that here we have ribs number 1 is at the same level as this bone, which is called the clavicle. You can sometimes refer to the clavicle as the left and right clavicle, because it really is made of two pieces, and it's better if you can specify whether you're talking about the right piece or the left piece. But the clavicle is commonly referred to as the collarbone, right? Clavicle. Okay. Next, this part right here, this bone running down the middle at the front of the thoracic cage, is commonly referred to as the sternum. It's commonly referred to as the breastbone, and it is technically called the sternum. And I probably will ask you this on a test. I will ask you to tell me what are the 3 bones that make up the sternum called. The sternum is actually made of 3 different bones. The top bone is called the manubrium. The thickest one at the top here is called the manubrium. At the very bottom, there's a little point called the xiphoid process. Right? So here's the manubrium pointing to this, right? And then the central part is called the body. And you might have remembered at the beginning we discussed the fact that hematopoiesis takes place. Hematopoiesis is the formation of red blood cells and white blood cells. Hematopoiesis takes place in flat bones. And the flat bones include the sternum. So all 3 of those bones that I just mentioned are good sources of red blood cells and white blood cells. It also takes place in the ribs, the skull, and the sacrum. Okay, so there we have the breastbone, the sternum, which is divided into the manubrium, the body, and the xiphoid process. And up there at the top we have the clavicle, and then we have 12 ribs. Now notice that starting from rib number 1, notice that you have this kind of little different color here. That's because that is not bone. These little bits here are not bone. They are made of costal cartilage. Right? So the ribs do not actually attach to the sternum directly. The ribs are indirectly attached to the sternum through cartilage, and we'll talk about that later. But notice that notice that some of the ribs are attached indirectly to the sternum through cartilage, right, at the same level, right? So those are referred to as the true ribs, because they sort of attach indirectly through cartilage at the same level with the sternum, right? Now notice that there's some ribs that go down here below the level of the sternum, and they're still attached indirectly through cartilage, right? But we call those false ribs, because we call them false ribs basically because they're located below the sternum, but they're still attached to it. Right? And notice that there are 2 in the back here. So we have 12 ribs in total, and therefore we have 12 cervical vertebrae. And the ribs that are attached to vertebra 11 and 12 are not connected to the sternum at all. Right? They're not attached to the sternum at all, and we call those floating ribs. Right? We call those floating ribs, as if they were floating on water or something, because they're not attached to the sternum at all. Not indirectly, they're not at the same level, they're not below it, but attached with cartilage. They're not attached to it at all. Right? So I often on tests I ask you which are the floating ribs and which are the false ribs, and I should warn you that the floating ribs and the floating ribs are considered to be false ribs as well, right? So all of those ribs that I just pointed to that are located below the sternum are considered to be false ribs, but only the last 2 are classified as floating ribs. Only ribs number 11 and 12 are classified as floating ribs. Okay, looking at the lumbar vertebra now, they are load bearing. They bear a lot of the body's weight, and so they have the thickest and largest of the centrums, the thickest bodies. Right, they are the most common cause of back problems. If you have compression of a disc or a slip disc or something like that, it usually happens inside the lumbar vertebra because they carry the most weight. Notice that the spinous process of the lumbar vertebra is kind of big and clumsy looking and curved like that. That's another characteristic of the lumbar vertebra. And notice that they do not have transverse foramina. They have left and right transverse processes, but they don't have holes in them. They don't have transverse foramina. And the left and right transverse processes are slightly they're shorter than the thoracic and vertebral ones, and they're kind of clumsy and blunt looking as well. One of the things that they're obviously lacking is costal facets. They do not, because they do not, the lumbar vertebra do not articulate with the ribs. Looking at the sacrum and the coccyx, they are, so we have, in the sacrum, we have 5 vertebrae that are fused together. At one time during our evolution, they might have been separate, but somehow they became fused together and over the millennia, right? And then if you look on the back, there are 4 transverse ridges, right? So that this is actually an anterior view. Sorry, you look at the front, and you have 4 transverse ridges. Right? And then you have 4 sets, 8 in total, 4 sets of sacral foramina. So there are 4 little holes there that used to be the spaces in between the vertebrae. Right? And then if you look at the posterior side, I apologize. If you look at the posterior side back here, you notice that you can feel it through your skin even. You feel that you have these little bumps, and those are that main bump down the middle is called the median sacral crest, which is located on the posterior side. And then down here at the very bottom, we have a little tiny bone called the coccyx, which is commonly called the tailbone. The coccyx is a little tiny tailbone that in many people it is slightly too long, and if it's slightly too long it causes problems because it makes it painful for you to sit up straight, right? So if you've ever seen people who slouch, they may be slouching because they're lazy, but they may be slouching because their coccyx is a little bit longer than it should be, and therefore it kind of pushes on the skin underneath the coccyx and causes pain. Right, so so don't be too quick to judge people who slouch. It may be because they have an extended coccyx. Right, so here we're looking at the posterior side of the sacrum, so you can see the median sacral crest. That's easily visible through the skin at the back of the body. Okay, again, let's take a closer look at the thoracic cage. Okay, so we have the sternum. The sternum is made of the manubrium and the body, and the little point at the bottom is called the xiphoid process. Right? If you can feel the xiphoid process with your finger if you feel towards the bottom of your rib cage, and there are 2 types of people in the world. One type of people have a xiphoid process that points straight down, and other types of people have a xiphoid process that points forward a little bit, so it feels like a bump. Right? So there are 2 kinds of people in the world. They either have a xiphoid process that points forward versus pointing straight down. It's nothing to worry about. Sometimes people go to the doctor and they're worried because they have a bump and they're worried it might be cancer or something like that. It's actually just the fact that they have a curved xiphoid process. Right? And then we have the body of the centrum and the manubrium of the centrum. And this is another anatomical landmark at the very top of the sternum called the jugular notch. It's called the jugular notch. It is also sometimes referred to as it is also I don't know if you saw a movie called The English Patient, uh, but there's a famous line in The English Patient where they're trying to figure out what that bump in the hollow of your neck is called, and one of the guys says it's called the suprasternal notch. That is another name for it. The suprasternal notch is also known as the jugular notch, which is a dent in the top middle of the manubrium. Right now, this is perhaps a little disturbing to talk about, but if sometimes people get into terrible traffic accidents and things like that, and if something happens to close off their trachea so that they can't breathe, the emergency medical personnel that are on the scene will have to cut a hole in their neck so they can breathe, and they insert a ventilator. Right, so that's called a tracheotomy when they do that, an emergency tracheotomy. If something happens to the trachea so that it breaks or swells shut so they can't breathe, it's a matter of minutes before they die, and so you have no choice. You have to take out a knife or even a pen or something, and you have to do an emergency tracheotomy. And the way that you feel for the right place to cut the hole is you take your finger and you push it into the jugular notch so you can see where it is, and then you cut the hole just above the jugular notch. Now that's not something I would not advise anybody to do that. That's something that only emergency medical personnel should do. If they're going to be there, let them worry about that, because that's an easy way to kill somebody as well. So, but anyway, that does happen with some frequency, with some regularity in traffic accidents and things like that. And so when you're doing an emergency tracheotomy, the anatomical landmark that you look for is the jugular notch. So the jugular notch is yet another anatomical landmark. We're going to learn several. You know what a landmark is, of course, right? It's some feature on the landscape that you can use to get your bearings, to learn where you are, to figure out where you are. All right, so on either side of the manubrium, where the clavicle is attached, right, you have the two clavicular notches and the jugular notch on the top of the manubrium. Right? Okay, so there we are, the jugular notch at the top, the left and right clavicular notches on either side which articulate with the clavicle. So the manubrium, this thing here is called the sternal angle, the suture where the manubrium is attached to the body. And then there's another suture, but it doesn't have a name, that attaches the body to the xiphoid process, and there's the xiphoid process at the bottom in the inferior end. Okay, so the word costa refers to ribs, and so if you talk about the spaces in between ribs, they are referred to as intercostal spaces. Intercostal spaces, and we already learned that the word osteo means bone, and now we know that the word costa means ribs. Okay, so the ribs articulate, the thoracic vertebra articulate with with the ribs, and so that's why they have the superior and inferior costal facets. Right. And then they also articulate with the sternum, but not directly. They articulate through costal cartilage. Costal cartilage. So it's a special type of cartilage that is associated with ribs. Right. So if you see a skeleton that's been decomposed for some time, you'll notice that the ribs don't actually touch the sternum. They're connected to the sternum through cartilage, and cartilage usually decomposes long before bone does. All right. So ribs number 1 through 7. We do need to memorize this. Ribs number 1 through 7 are called the true ribs because they're at the same level as the bottom of the sternum. So they're at the same level as the sternum. We call ribs we call ribs 1 through 7 the true ribs because they articulate indirectly through cartilage. They articulate with the sternum at the same level. Okay, then ribs 8 through 12. Ribs 8 through 12 are called false ribs. and the last two, rib 11 and 12, are called the floating ribs because they don't connect with the sternum in any way. Right, so the ribs 11 and 12 are the floating ribs, but they are also classified as false ribs. So this, what I've drawn here, is a little bit misleading because I'm saying that ribs 8 to 10 are false ribs, but in fact ribs 8 through 12 are false ribs. But only, so the last two are floating ribs, right? So the floating ribs are false ribs, but not all false ribs are floating ribs, right? So that's, so the floating ribs are false ribs, but not all false ribs are floating ribs. All right, so to discuss what we discussed, or to summarize what we discussed the various parts of the cranial vault, the skull, the mandible, the maxilla, and so on. We discussed some of the holes in the skull. We discussed the various characteristics of the spinal vertebra, some pathologies of the spine, and we discussed the ribs, which are the true versus false versus floating ribs, and that is the axial skeleton. Okay, I'm not going to lecture on this because you're about to have a test on this, right? And you're about to have a test in your coloring book, so you're going to read all about the the pectoral girdle and the pelvic girdle, which are the areas where the arms and the legs attach to the axial skeleton. So you're responsible for knowing all the names of the bones of the pelvic girdle, all the names of the bones of the pectoral girdle, the names of the arms and the legs, the names of the the tarsals, the metatarsals, and the digits in the toes, the phalanges in the toes, as well as the arm bones, the carpal bones in the wrists, the metacarpals in the hands, and again the phalanges in the fingers. Remember that the phalanges, the term phalanges applies to both the bones in the fingers and the toes, unfortunately, so you have to specify whether you're talking about the hand or the foot. You'll see when you read the coloring book that they are numbered 1, 2, 3, 4, 5. Starting from the thumb is number 1, 2, 3, 4, 5, with the little finger being number 5. The same is true for the toes, with the big toe being number 1, and then 2, 3, 4, 5, with the little toe being number 5. Right, and then you have 3 phalanges, and then the singular term for phalange is, as we discussed in the earlier lecture, the singular term, a single phalange is called a phalanx. A phalanx. Right, so if you look at your index finger, for instance, the finger that you point at things with, it has 3 bones. There's a distal phalanx, a medial phalanx, and a proximal phalanx. The proximal phalanx is closest to the body, and the distal phalanx is farthest, and then the medial phalanx is in between, as you'd expect. Okay, so make sure that you go through the coloring book. You have a coloring book assignment about the bones, all questions drawn from chapter 3. It's an open book test, so you can't. It's a 2-hour open book test. You don't have enough time to read the book and answer the questions, do the open book test at the same time. So the idea is you read and study chapter 3 about the bones, and then you have 2 hours to complete approximately 40 questions that are drawn from chapter 3. And then next week, the following week, when we move into the muscle system, the bone questions that you did during the open book test this week could be moved over onto the quiz. Right? So, and the quiz, you have to answer 40 or so questions in 20 minutes, and so you don't have nearly enough time to look them up, and that's the idea, right? That's the whole idea. So the first time you study a chapter, you get to kind of leisurely answer these questions. You read it ahead of time, and then you have 2 hours to answer these questions. But because you've just read that material, you have leisure time to go through and find the pages and find what parts of the bones we're talking about, and so on. And then the next week you have to study it some more because some of those questions will appear on the quiz and you don't have very much time to answer. So we kind of move from not having read the material to reading the material to then being tested on it in an open book test where you're tested on it in kind of a leisurely way with a large period of time. And then you move further on to the quiz where you have to answer the question fairly quickly. And then some of those bone questions will continue to appear again and again and again on the quizzes in the future. And every time you see it and every time you answer those questions, you will understand the material better because you'll be exposed to it again and again, and you'll be asked about it again and again. Okay, so that's basically how it's going to work. And so we've had our lectures on the bones. You next have an open book test on the bones, and then from now on, beginning next week, you will continue to have questions on bones on the quizzes, and there'll be lots of questions on bones on the midterm and on the final. Okay, so good luck with your studies, and I'll see you for the next lecture, which is on the muscle system.